Hey, hello everyone. Welcome to the next episode of Fearless Beyond. In this series, we are trying to break stigma around ailments like cancer. And in this episode, I will be discussing about the neurosurgery aspect of my brain surgery, where the tumor was removed. So, in this episode, we will be discussing where did I get operated from, and naturally, because it was you know critical surgery, I had to take multiple consultations before finalizing where I want to get operated. So I will be discussing all of them in this episode, and big thank you to all of them who had supporting comments from my previous episodes, and I got really good suggestions on what kind of audio and video software should I use to make the content better. So thank you for all of them, and keep posting them and sharing them with me. It really helps. So let's dive into the um, so I would say I was blessed in a way. I had a strong support from extended family, my siblings, elder brothers who were supporting me throughout the treatment, and were also there to take consultations and multiple opinions in my case. Um, and I would recommend for anyone going through such a thing or any major surgery to have a network of your siblings or friends who know you well, to help you decide on the major decisions that will be taken for the surgery. So what I preferred was there was this core team of my elder siblings, one of my uncle, and of course parents were indirectly involved, um, and everybody. I prefer that everybody should have an independent view on all the consultations I take, and they should share their independent view on the consultation with me, and leave the final decision of selecting the facility and the doctor onto me. And I'm very thankful to them that they cooperated with me and helped me in this way. And this was the way I prefer to take decisions. It might not resonate with a lot of you, and that is totally fine. One should take the way that is good for them to make a wise decision. This was the way for me. So all the consultations had a common agenda. There were a common set of questions. What was the doctor's independent opinion on my case? We did not used to tell the doctors that we have shown the case to some other doctor, but I think all the doctors know that in such a case, people of course take multiple opinions, and no doctor can assure you that they will actually solve the case fully. So, and I guess I was blessed in that way that some of the doctors did share their opinions, and also asked me that I should uh, take other consultations, and wherever I personally feel comfortable, go ahead with the procedures over there. So apart from this, uh, there was discussion around the analysis of risk of the procedure that the doctor was thinking to perform in my case, the prognosis of the case, on both sides, whether it was a very good case or a very bad case, the cost of the treatment, and that included not just the surgery, but the other treatments that might or might not come. So we had to be prepared from the financial aspect of it, because such an ailment can actually give a heavy financial dent on the family also. The first consultation happened at Medanta Institute in Gurugram, and it was with Dr. VP Singh, who was the chairman of neurosurgery over there back then. I think uh, he still holds the chairman position at Medanta Gurgaon. His advice was to go ahead for image guided craniotomy at a good facility which has image guidance. He had access to intraoperative MRI technology, This is some technology which Medanta has, and what happens through this is uh, during the surgery, when the cranium is open, the surgeon can actually opt in to perform an MRI over there, so that after he has removed the tumor, he can perform an MRI to see if there is any residual tumor which can be further excised from the brain or not. So he was preferring to use it in this case, and it will help him in resecting the full tumor. On coming to the risk part of it, there were chances of weakness, but his main point was that if you delay the surgery, the risk will increase, and there is very high chance that within a few weeks I might be bedridden. So his primary advice to me was take consultations, and very calmly he said that wherever you prefer going ahead for surgery, go at that place. Very helpful consultation from him over there. The next consultation happened at Fortis Memorial Research Institute in Gurgaon with Dr. Rana Patir. Now, Dr. Rana Patir is also an eminent name in the neurosurgery area of India. And both Dr. V.P. Singh of Medanta and Dr. Rana Patir are also trained from AIIMS, Delhi, which is a premier institute of premier medical institute of India. And Dr. Rana Patir's suggestion was to go ahead for image-guided craniotomy. Image guidance means the MRI scans or CT scans in some case will be used as a GPS to reach to the location of the tumor, and the agenda was to use them as GPS and avoid any eloquent area in between, damaging the normal brain as least as possible. He also said that awake craniotomy can be thought, but he doesn't usually prefer it because it is usually uncomfortable for patients. Now I will come to the awake craniotomy part of it towards the end of this video, but that was his initial opinion. Upon asking about intraoperative MRI, his opinion was he has used the technology in some of the institutes where he used to work previously, but currently Fortis doesn't have it, and moreover he has not found significant difference in the way he operates when using intraoperative MRI and when not using it. But he was also very helpful in giving suggestion that if you want to use intraoperative MRI, you can actually think of taking consultation from Medanta because they have access to this technology, but he personally doesn't prefer it. The third consultation happened at AIIMS in New Delhi with Dr. Ashish Suri. His opinion was also to go for surgery under image guidance, guided by MRIs or CT scans. As per him, intraoperative MRI is not required in my case, and he did take some time to explain it to me why is he giving that suggestion. So his point was that the aim of the surgery is the safety first. We would be more inclined towards preserving your motor functions and the eloquent areas of the brain. And as per him, intraoperative MRI is required when they have to fully take out the tumor. In my case, he very explicitly said that we will hit the safety margins of the motor areas first, than hitting the margins of the tumor. So he was very sure that your tumor, based on the tractography scans that I had shown in the previous video, he was very sure that they're actually going through the tumor region. So we will not be taking out the full tumor. If we do that, it will result in motor deficit. So I asked him that, what should I do? So his point was that go to any institute where they have image guidance and get operated over there. As per him, all surgeons are good. Yeah, I think that is true to some extent. And I did ask him that if he does it over here, what would he prefer? So he said that he will prefer doing awake craniotomy in my case. Now, Coming on to the comparison part of it, the first consultation was at Medanta with Dr. VP Singh. We found that the doctor was very good. Hospital is good in terms of tech, but I mean, my primary concern over there was when I was taking OPD consultation, there were patients in distress who were brought to doctor's cabin and waiting outside there on wheelchairs and on hospital beds. And that was a bit distressing for me because I was imagining that, if I'm admitted over there and I'm being brought in front of everyone on beds and on wheelchairs, it will be distressing for me, and it will be distressing also for my relatives and family over there. So in terms of tech, Medanta is definitely very good, and fortunately, by the grace of God, we were able to, finance was not a question because I was able to afford the treatment based on the quotations that they had given. The next consultation, which happened at AIMS Delhi with Dr. Ashish Suri, again the doctor was very helpful. A doctor of AIMS giving you extra time to explain why he would not prefer this and why he would prefer something else was something that I personally admired the most, and I think it is very important to foster your confidence in the doctor so that you can ask anything with the doctor at any stage of the treatment. In terms of hospital, because this is a government funded hospital, the tech of the hospital is of course top notch, and I think they have one of the best facilities in Southeast Asia, and the doctors are also good, but the hospital lacks I feel the basic hygiene and the paramedical stuff which is essential for post-operative care. That was a feedback that I got, and that is something which I also felt when I was there taking consultations. In terms of affordability, of course, it was AIMS, a government-funded institution. Affordability was not a concern. The cost of the treatment, the surgery, and everything was within our affordable limits. The third one at Fortis Gurgaon, we found that Dr. Rana Pathar was also super helpful. The hospital was equipped with good technology. It was not as good as Medanta in terms of intraoperative MRI was not there, but whatever the surgeon needed was there, and the surgeon was confident. And fortunately, of course, over here also affordability was not a concern. Based on the quotations that they had given, we were able to, we planned and we were able to afford the treatment over here. If I say that which one was costing us the heaviest, it was Fortis Gurgaon, and AIMS was the cheapest, and Medanta was also, I think there was a difference of I guess 50,000-60,000 between Fortis and Medanta. Now, coming on to the final decision, my family's decision from the core committee of my siblings was let's go ahead with Medanta. And they also gave reasoning for it that, first of all, the doctor is very good in terms of technology. Medanta is, of course, top notch. They have intraoperative MRI. And if the doctor anytime feels that they need to use intraoperative MRI, they will have access to it. This was not the case with other hospitals because in Fortis they had clearly said that they don't have intraoperative MRI. In AIMS, the doctor was not in favor of using it. And after this, the final decision was left to me, and my cousin said that whatever your final decision is, we will be there to support you in whichever hospital you choose to go ahead. Now, I personally felt that I should get operated from Dr. Rana Pathar at Fortis Gurgaon, and I do not have a logical reasoning for this because it was, I think, primarily the interaction with Dr. Rana Pathar, And when I separately asked my uncle also about it, he also said that he would prefer Dr. Rana Pathar. And I asked him that, what is the primary reason? So his point was that he had a very clear view as to what he wants to do, and uh, given that, if the case goes ahead, what would be the prognosis, and how can we proceed with the treatment. But that was not a deciding factor for me. The deciding factor for me was the personal interaction which I had with Dr. Pathar, the clarity of thought that he gave to me. And he even said that I should take consultations from other places, and uh, wherever I feel comfortable, I should go ahead with that. So finally, we went back to Dr. Pathar, and this was the final consultation before the treatment began. And so over here, the discussion was around what kind of surgery will he perform. So he discussed it with his radiologist, and he came up that they would prefer to do it in an awake manner, meaning awake craniotomy. Uh, and the primary reason for that was safety of my motor cortex. And before the surgery, he also recommended that I should also get a visual field perimetry test done for peripheral vision. So there was some involvement of the occipital lobe uh, initially that was looking in the MRI. So he said that we can actually go for visual field perimetry. My eyesight was okay. So perimetry is for peripheral vision. So in medical terms, if you are looking at something, your eyes also have the ability to, at least with a blurry vision, see what is there uh, in your right and in your left, and that is what is called peripheral vision. And there are regions of the brain around the visual cortex which are responsible for that. And so I went ahead with the visual field perimetry test uh, at uh, at Fortis Hospital itself. And the visual field perimetry test results looked like this. As per the analysis of the eye specialist and my surgeon, they looked very normal. The interpretation was the tumor had not uh, displaced my peripheral vision. It was okay, and through the surgery, we will not have any impact expected on the peripheral vision. However, if there is any impact, you can always rotate your neck slightly to see what is there in the periphery. But the good part was that the surgeon was comfortable that we will not be damaging any of the peripheral areas, because they are not involved in the tumor. After this, when the hospital and the doctor was decided, I was told to go for a pre-surgery counseling. The first part of it was to book a date for the surgery. I don't know if that is the standard thing at all the hospitals, but at Fortis Gurgaon, I did get the option to choose a date of my choice in the following week based on the doctor's availability. So I did a booking for the surgery for February 7th, 2024. After this, I was referred for a briefing about awake craniotomy to the anesthesiologist. And I will come to the awake part of it afterwards. But after that briefing, my PAC was done, meaning pre-anesthesia checks, which included ECG, chest X-ray, normal routine blood tests, which are done before a surgery which involves giving anesthesia. And because my surgery was an awake surgery, and in an awake surgery, the patient was not given full anesthesia. The patient was given local anesthesia and sedated, and then when when in the middle of the surgery, the patient is also awakened, and the patient is fully conscious. Then they ask him some basic questions and test his or her functionality of the hand, eyes, memory area, speech, to see if they have not touched any critical area. So after this, the anesthesiologist gave me a form in which I had to give my consent for local anesthesia and general anesthesia. He did explain to me that in your case, we would be doing it via local anesthesia, and the consent for general anesthesia is only being taken in case of an emergency, because sometimes patients panic in the operation theater, and at that time, for the safety of the patient, they have to give full anesthesia to the patient and perform the surgical procedure safely. So one day before the surgery, on the 6th of Feb, I traveled from my hometown Dehradun to Gurgaon, and the plan was to get admitted. So I got admitted in the hospital, and it was very much like a hotel check-in. And 6th of Feb was my first night stay in the hospital. After checking into the hospital, in the room, I was briefed about the hospital facilities, the emergency buttons, and other things which I might need in case of emergency. The facilities of the hospital, which would come handy to me. I was also told that I would be on complete fasting post 10 p.m. In the night that day, because the next day was surgery, and before the surgery, I had to be on fasting. And to take the essential medicines that were started post my diagnosis, anti-epileptic medicines, I can take them with minimal water. And I do have to admit that as brave I looked at that time, I have to admit there was a slight nervousness on the day of admission. And I think some of it is understandable, irrespective of how brave you are. I mean, you're not in your comfort zone. You're not at your home, and you're going to have a major procedure done the very next day. So some of it, I think, was understandable. But anyone going through any such condition, I will recommend do carry some healing rag or music which can be used to calm you down, and have them in your mobile or laptop, whatever you would be carrying. Do not depend on Wi-Fi and mobile internet all the time, because the hospitals at times have jammers in them, which will make the connection of mobile and these things a bit difficult. And after that, I think there was some self-talk with myself to keep the morale high. I mean, I think maybe that is the way I usually operate. So after that, around 7:30 to 8 p.m., the duty doctor came for basic assessment. They reviewed my scans, did some basic assessment, like they asked me how would a clock look like if there is 10:50 p.m. in the clock. So I had to draw the small hand of the clock and the larger hand of the clock, and that was my basic assessment. They gave me some basic math problems to solve to see that how is my normal brain response coming. And also there were some motor function checks. They asked me to hold the hand. They gave me some basic hand puzzles to solve, and they were observing me that how am I solving them. But after that, they counseled me that everything is normal, reviewed the scans, and counseled me for the surgery, that they will be there in the operation theater over there, and if there is any question, I can always reach out to them. After that, I tried to sleep early, because the next day was going to be a big day. My mama or uncle stayed with me in the night. There was one bed for an attendant, and the next day was the surgery day. So 7 a.m. in the morning, I got up. I took my regular anti-epileptic medicines with minimal water. The nursing staff had come in to put a cannula on my hand, through which IV infusions will be given during the surgery. And I think somewhere around 15-20 minutes after that, there was a nursing staff which had come in to remove my chest hair and pubic hair. And I think it is natural to feel super awkward and very embarrassing. But I knew it was a standard procedure which had to happen, and that is for your own safety, cleanliness, and to avoid any infections from the hospital. After that, I was asked to take a shower with a disinfectant body wash, and this was a pre-surgery requirement. There was a nursing staff who offered to help, but I was more comfortable to, take a shower myself. So after that, I was in the surgical robes and was made to sit on the wheelchair and move to OT. I did say that I want to walk to the OT, but the nursing staff said that no, you have to sit on a wheelchair and we will be moving you to the operation theater. It was on a different floor, so my family and cousins accompanied me till the operation theater. And I think it was around 8 a.m. in the morning. I was in the OT, and this was, February month, so winter season in Delhi NCR. I had caught up allergic cough and cold, but they took care of it on the operation theater, on the operating table itself by giving me some medicines through a nebulizer to control my coughing and cold. And after this, another super awkward thing started happening. I knew this was supposed to happen. That was catheterization, so that that there is no urine blockage in the body, and it naturally passes out with the tubes that are put in the body through urethra. I did tell to the doctors over there that I'm not afraid of the needles, but this is the part that afraids me the most. And they were, I think, they are pre-trained for situations like this. So they did calm me down with by just talking to me, and they just instructed me, and I followed what they did. And I think before I knew it was over, I did not even felt anything, honestly. And after that, they asked me to lie down on my left shoulder with the right side of the head up, because they had to approach the tumor from the right side of the head. After this, the briefing of the procedure started. The doctors over there briefed me that I would be sedated, not given full anesthesia. Again, there was a briefing around the awake. They said that because it will not be full anesthesia, there will be injections given on top of my eyebrows, which will block the pain receptors which are coming from the head. And I will feel heavier after that. And they said that you feel free to sleep, and the rest of the procedure will be taken up by them. And so I did say to them that it was too cold in the operation theater, so they gave me a thermal blanket with a hot blower, so that did help me sleep very soon. And in the meantime, they had fixed my head on the cranial stand, and which was necessary because when my skull is open, there should be no movement from my side, so that the surgeon is, the surgeon is able to directly reach to the tumor area, and there is no movement from my side which can damage the brain. And before I knew, I just observed that they had started shaving some part of my head. Probably that is the region from where they had thought to start the incision and give the cut and approach the tumor. And I don't think so I remember anything after that for some time. So I'd slept, and I think it was, I don't know how much time would have passed, but I could sense that there is some tickling happening around my head. I could hear the voice of the drill, which I guess was used to cut my skull. And they had told me this before, and that you can hear all those sounds. You would hear us talking. Just don't panic. Keep lying on the table and just try to sleep. And I guess if I map the events, it would have been probably around 9 a.m. when my primary doctor, Dr. Pathar, would have come and took over the surgery. And so when he took over, I could hear his voice, and I think this was the awake part of the surgery. The level of anesthesia must have been lowered down, and my anesthesiologist was holding my hand and calling out my name, pressing my hand to wake me up. And and he asked my name. He asked me which hospital I was in. He asked me the date, the day, and what ailment do I have, what was my doctor's name, what would you like to do in the life, all those are things. And he also asked me that where would I like to travel, and all these questions he had asked me previously. So it was just to judge that how am I responding. And I think apart from that, it also helps the patient to calm down and make the patient more used to them. So after this, because my motor area was primarily involved, they asked me to do some motor movements. I was asked to count 1 2 3 4 5 on all the fingers, touching my thumb to all the fingers. I was asked to count 1 2 3 4 5. And for the ankle, they asked me to move the ankle laterally and axially to see if the ankle movement is fine. And all this time there was surgery going up in the head. I mean the doctor was operating on my brain, the surgeon. So I heard after that that the consultant who had come to meet me the previous day and was also there when the surgery started, she said that, sir, I think the leg is getting involved. I was already exhausted by all the exercises, and I think that is where the surgeon stopped the surgery. And after that, Dr. Padar himself uh, came in my peripheral view and said, "Ho gaya, so jao." So meaning it's done, go to sleep. And then his team took over and done with the cosmetic and did the cosmetic procedures of uh, closing the skull and fitting uh, the bone plates back with the titanium screws and everything. So after this, I think the next memory I had was when the surgery got completed, and the consultant said that it's done. You will be moved to ICU soon. On the way out, you can say hi to your family, and in the meantime, you will be moved to ICU. I promptly asked her. I was saying that there was a clock in front of me on the wall. I asked her, "Ma'am, what is the time by the watch over there?" She said 1 p.m., and that was one of my happy moments because I myself was seeing 1 p.m., 12:55, 1 p.m. over there. So I was happy that she reconfirmed, and my at least my eyesight is okay. Uh, After this, they moved me onto a portable bed and started moving me out of the operation theater. And on the way out, I remember seeing faces of my cousins before opening eyes in the ICU. I think I probably would have slept on the way to the ICU. It was very comfortable and wobbly kind of bed, which makes you sleep. And I'm glad I recognized my cousin, so that was also a moment of relief that at least my memory and everything is okay as of now. So after I went to the ICU, my family also came to see me, and I think I will share some playlist of these kind of neurosurgeries and some videos of the neurosurgeons I consulted in the description section or the comment section of the video. And I will recommend that wherever you take consultations, do search about your surgeon because your trust is going to be of paramount importance wherever you plan to get operated for whatever procedure. So research about your treatment, research about the treating team, and research about the hospital, and establish your confidence in it, and then go ahead with any such procedure. As all as always, if you like the video, support me by giving a thumbs up. Share your comments in the comment section, and share it with anyone who might benefit from this video. And keep your wishes and blessings coming in. I am very happy to get connected with some of my old colleagues, teachers, and friends. So keep supporting me like that, and I hope that the mission with which Fearless Beyond is founded, it keeps itself in its true spirit and gets the support of people and is able to help many other people by overcoming their own fears, breaking stigma, and building hope for the people in need. For any questions, suggestions, and wishes, please do comment below. And to support us, if you like the video, please do press the like button and subscribe to our channel on YouTube. Thank you.